2015 and some of the changes coming in 2016. And I wanted to take some time here to walk through a couple of actual examples using Medicare.gov and just go through step by step so you can see how the tool works. And again, if you're going to do it yourself, I hope this helps guide you through the process. So the first thing you should do is go to an internet browser and open up Medicare.gov is the website that we start with. And you're going to highlight under Drug Coverage Part D where it says Find Health and Drug Plans. And your next step is to enter in your zip code, since these are service area specific drug plans. And I'm just going to enter in the office zip code here. Step 1 here where it says enter information, really for the majority of people and for the sake of the exercise here, we're going to just select Original Medicare, and under the second section, if we get help from any state assistance programs, we're just going to say I don't get any extra help. And again, for the majority of people, this is a pretty standard selection here for entering information. We click continue, and step 2 here is enter your drugs. And in this example, the individual I'm going to be entering has 3 drugs. The first one is called Benecar, and he's on 20 milligram tab. He's taking 1 per day, which is 30 per month, so that's the right quantity and the right frequency. And he gets his drugs from the retail pharmacy. So I'm going to hit Add Drug and Dosage. All right. And the second drug is Crestor. So we're going to add in the Crestor drug. And this one is a 40 milligram tab. Also 30 quantity once per month. So if he was taking 2 per day of a particular drug, you would enter 60 per month, or depending upon the frequency, you would just use this quantity to adjust based upon how many per day the individual is taking. Again, from a retail pharmacy. And then the last drug is a Welchol, and this is for this is a diabetes drug, and currently taking, we said 2 per day, so this would be 60 per month, not 180. Add drug and dosage. And after all the drugs are entered, these are the 3 drugs the individual is currently taking, we're going to click My Drug List is Complete. So step 3 is to select the pharmacies. And it automatically is looking at the closest pharmacies to the current zip code. And if you don't see the pharmacy you like, let's say CVS is one of the pharmacies, you can extend this out further. And there's a CVS that's 2 miles away. So we can add CVS pharmacy, and then let's go with Barron's drugs as well. So you can add up to 2 pharmacies to see what the different pricing is going to look like depending upon those 2 pharmacies. Continue to plan results. All right. And now step 4 of 4, it says refine your plan results. Since we're just looking at prescription drug plans, you just check that first box for prescription drug plans. In New Jersey, there's 22 plans available for just prescription drugs. So continue to plan results. And this should give us all 22 of those drug cards. And they're listed, here we go, prescription drug plans. 22 plans were found. And they're listed based on the lowest overall annual drug cost for these drugs. So the least expensive out of all the drug cards, these are expensive drugs this individual is on, which I'll show you in a minute, but the total expense, the least expensive one is this Envision RX Plus Silver. It would be an annual cost of $2,576. That's all in. That includes the cost of the premium for the card, plus the cost of the co-pays for the drugs that the individual is taking. If he chooses mail order, it would be the $2,733. But these are the all-in costs. This is what's important. We looked at the prior video about looking at the total annual cost. this is what you want to look at for what's this going to cost me for the year for my drug card plus the cost of my drugs. So the monthly premium is important, but it's not as important as the total cost for the year. So this card has a $40.70 premium. It also has a deductible of $360. But again, this is all factored into this total annual cost of the $25.76 for the year. If we scroll down and we look at a couple of the others, SilverScript's choice is the second on the list. For this individual, the total annual cost is $27.29 versus the $25.76. The premiums are lower, but the overall annual cost is slightly higher, which is why it was second in the list, not first. And these numbers just continue to increase as you go down. The $27.48 for the AARP card, $2,800, $2,854, and it just continues to increase the total annual cost as you scroll down the list and look at all the different options. This is just the top 10. If we want to look at all 22 options, you can look at them by clicking this View All button. But for now, let's open up this Envision RX card and look at the specific cost of the drugs within this card. Again, the premium is the $40.70. It has a deductible of $360. It shows you, based upon the two pharmacies we selected, what the total annual cost will be at each of them. So if you go to CVS, it's the $2,884. Barron's Drugs would be $2,575. More of a local pharmacy would be a little bit cheaper than the CVS. So just good information there. It also breaks down the cost of the drugs at each of these locations, at CVS, Barron's, and mail order. What's the full cost of each of these drugs? Very expensive drugs. This is per month. $150, $221, $177. Total monthly retail cost, $549 per month. So pretty expensive drugs when you add up these three drugs. So in the deductible phase, this individual would pay the full retail cost of each of these drugs. He's going to hit the deductible in that first month because the deductible, again, is $360. But this is just showing you what you would pay for each of these in that phase. Once you get to initial coverage level, it goes down to a coinsurance. So you can see $28, $42, $33. So much, still not cheap, but it's a lot less than the retail cost of the drugs in that initial coverage level. This individual will reach the coverage gap, which I'll show you in the middle of the year, where they start to spend the 45% of the cost of the brand name drugs. So their total cost per month is going to go up to $247 just for the drugs. So very expensive. Again, the retail cost is that $549. And if you remember from the other video, the coverage gap starts at $3,310 next year. So he's going to hit that in about 6 months. And this is just a chart that shows you what the expenses would be at in this case, CVS. He's going to hit that deductible in that first month, so his total expense will be $437. Then he's going to just be paying copays for a few months. So his total expense between the copays and the premium for the card would be the $145 per month for the next few months until he hits the donut hole. And when he hits the donut hole, he'll pay the premium for the card plus the cost of those drugs at $240, $247 a month, which really starts to add up to get to that total expense for the year that we had talked about. And there's some more information in this report as well, but the most important aspects are understanding what the total cost for the year is going to be, understanding the retail cost of the drugs, the copays in each of the phases, or the coinsurance, or what you're going to pay for the drugs in each of those phases, so you can really plan out your year. That's essentially, how this individual's drug analysis worked for the three drugs he was taking. So this would be the least expensive card for the year. You could, again, look at some of the other cards that were out there by going back to your plan results and getting the same level of detail for each of these other options. If you wanted to click on the SilverScripts, you could look at that, or the AARP card. These are similarly priced, $2,500, $2,700 for the year. This one has a zero deductible, so that may be interesting to certain individuals. They're going to spend potentially a little bit more, but to have that comfort that they're not going to get hit hard in January with that big bill, this may be an option that some individuals would look at. But the least expensive for the year looks like this Envision RX Plus card, and that's what we would recommend between one of these two cards for this individual. So I hope that was helpful in helping you understand how you enter the drugs through the Medicare.gov tool, understanding the results and the report that's available when you do the analysis on Medicare.gov.